Hello, everyone. Welcome to another episode of CR Arthritis. I'm Kelly Lendvoy at ACE, and it's my pleasure today to speak to two leading rheumatology experts from the great province of Alberta, Dr. Steven Katz and Dr. Jill Hall. Dr. Katz, the director of the Division of Rheumatology and section head for rheumatology for Alberta Health Services in Edmonton. Dr. Hall is a clinical associate professor, faculty of pharmacy and pharmaceutical sciences at the University of Alberta. Welcome to you both.
Hello.
Thanks for having us.
Now, we're going to cover two topics today. And the first one, the leading in with our start here, is around an annual event at the annual scientific meeting. And it's something called the Great Debate. And both of you are participating this year in the Great Debate. And before we get into some specifics, maybe I'll ask you to describe to our audience, what is this featured event at the annual meeting?
I would say it's probably usually, maybe not this year, but usually a highlight of the meeting where we have two teams, usually two from the West and two from the East, two members on each team, debating some topical subject in rheumatology, usually making sure bringing good data, but also having a lot of fun with it as well. So there's usually smiles on everyone's faces throughout. So I think quite the highlight because of that. Usually, we'll can't say this year or not. But.
Yeah, I haven't participated, but I've certainly been in the audience. And Steven, it sort of reminds me, it's all fun and games until somebody gets hurt. That's probably a good a good subtitle for it. So this year's Great Debate, as you said, it's usually, focused around a hot topic in rheumatology. This year, the Great Debate title is Be It Resolved that EMRs, electronic medical records, save time for healthcare providers and improves quality of care. But we are going to get a chance to take a peek inside your arguments, your rationale for or pro EMRs, because that's where you're going to be resting this great debate. And full disclosure, Ace and myself are based in Vancouver, so I'm going to try not to let my Western Canada bias enter into this at all. But go Team Alberta. So pro side, do EMRs save time for healthcare providers and improves quality of care? So I think what we're interested in finding out is that we know rheumatology, the specialty focusing around autoimmune disease and musculoskeletal disorders involves really complex patient management. And EMRs, I think, have revolutionized the way healthcare is being delivered in Canada, and probably particularly in an area like rheumatology, with those special needs of patients and their interaction with the healthcare system. So maybe that is an intro you can give us at a high level where both of you are approaching and sort of landing on this topic.
Yeah, I think that's a great introduction. I mean, so we are supposed to argue the pro side of EMRs, and I think so we're very ingrained in that right now and would fully support that. I think your comment though, in terms of rheumatology really benefiting from this is apropos. I mean, if I think back to the alternative to EMRs would be going back to a paper chart and pen and that sort of thing to manage folks who have been sometimes on numerous different medications over many years, and to track that and to track lab results and different prescriptions and all those sort of things. If you can imagine in a chart, paper chart, they would get bigger and bigger and bigger. To be able to leaf through that and find the information that you need gets very complex. When you're talking about complex care and continuity of care, when folks that we're seeing, usually we're not seeing one or two times, but over years, decades sometimes, right? So having everything in an EMR right away makes things more efficient, probably better care, and that everything's accessible really quickly and easily to be able to take a look at patient information. I think beyond that itself, I mean, just being able to write or type prescriptions much faster, to look at labs and trend them over time. I mean, in Alberta, we're very lucky that vast majority of EMRs within Alberta Health Services, it's all one system. So anyone who has a lab done, we're able to see it. Doesn't matter if it's done in the south of the province, north of the province, we get to see it all and track it all at the same time. Very efficient as well. We're able to create templates for notes, so you're not recreating the wheel every time when you're doing that, which ultimately means you have more time to spend with your patient and less time in terms of needing to do the chart documentation part of things.
Yeah, I think being in Alberta and having access to an electronic health record for a long period of time, going back to 2006, we've had access to that lab work and diagnostic imaging and other facets of, you know, that patient health record across all sectors. So as a pharmacist, I'm always thinking about, you know, yes, what's happening in the hospital or in the ambulatory care clinics, but also what can pharmacists or other care providers, family physicians in the community see and access as well. So I think it's hugely important for coordination of care, helping patients feel more confident that their healthcare providers across those different sectors have access to the same information and are able to communicate with each other through those electronic means as well, much more efficient than the dreaded fax machine, which I think is finally going away in pharmacies across the country. So talking with friends and colleagues in other provinces, I think we're leading in this regard in a lot of ways, and hearing about the struggles and the challenges that don't even come to my mind when I think about providing care in terms of documentation and figuring out what has happened with a patient in the recent past. So I wouldn't have joined the team if I wasn't on the pro side.
Our audience and members here at ACE have heard us talk a lot about models of care in Canada, and certainly in the context of the gaps that are, you know, have been clearly identified in models of care. One of them is the access to care in northern, rural, remote regions of Canada, in the northern areas of provinces and certainly in the territories. And we've actually talked to Dr. Katz about that, and specifically in the context of treatment and care in the Northwest Territories and the role that he and other doctors in Edmonton have played in terms of providing those services for patients in Northwest Territories. This argument you're making seems to have some very real practical applications in that context, and maybe you can provide us some insights on that.
Yeah, I think, you know, again, if someone has their labs done rurally in the past, it meant that there would be a delay upwards of a week of getting a lab result, for instance, right? Because everything wasn't interconnected. Nowadays, it gets done, like I said, anywhere in the province, and I'm going to get it just as quickly regardless where it's done. And we certainly still notice that gap. I mean, we don't think about it very often, but as you said, you know, right now we're seeing a lot of patients from Northwest Territories and Edmonton. That's not integrated into our system. So there is, a week or 2 weeks before we're getting those lab results, which then does potentially impact care. We see some patients from Saskatchewan, British Columbia as well, where again, it's not all integrated into our system. So that can interrupt care, the speed of care as well. But even with when COVID started, there was opportunities, not that it's probably quite ready for prime time, especially in rheumatology, where doing physical exams is really still important, but integrated virtual visits right into the EMR. We have that ability if we wanted to as well. So I think there's lots there, probably a lot more yet to come, but particularly for those populations, I agree that there's great opportunities.
Is there, I think from a patient perspective, is there an opportunity or a facility where patients can interact with EMR? Like, are there portals or access for people to be able to benefit and track their own care?
Absolutely. In Alberta, there's a few different ways through our EMR. So in Alberta, the EMR is called Connect Care. There's a functionality which they branded My AHS Connect, which allows us to send direct, secure messages to patients. Patients can start those messages there on their own as well, so we can have back and forth communication there, which allows for quite rapid access rather than needing necessarily to call the office, have someone answer, leave messages, that sort of thing. But at the same time, they're able to take a look at all their own lab results for themselves and trend them, and review potentially what medications they're on, if there's any uncertainty there, and really have access to the information that belongs to them.
I think it's really neat too in clinic when patients come in and say, sometimes I had my blood work done last week. Did you see it? Do you have access to it? And I can show them that it's already loaded automatically into my template note in the EMR, and it highlights anything that's abnormal. I can reassure them, but oftentimes too, patients are coming in and said, I had my lab work done. I noticed my CRP is high. Is that a problem? Like, is that something I need to be concerned about? And so, having both sides of that, patients just aware that they can ask questions and in a way advocate for themselves in terms of, what is going on with respect to their medications, but also get clarity around, a number is high or low, and is that something we are concerned about? And take that opportunity to learn about that facet of their care as well.
Certainly, we talk to our audience a lot about self-care as one of the key elements of models of care for arthritis, and particularly for people living with inflammatory arthritis diseases, which again are very complex, complicated. This is something that's really, really important. And it just would seem to me to promote things like adherence as well, that you would probably see some really positive results there. I want to continue on this theme of patients being sort of at the center of this healthcare team around them. We like to say they're the QB. Or captain of that team. I want to just turn from a focus on electronic medical records, or EMRs, and I think Dr. Katz mentioned how it can enhance sort of this multidisciplinary approach to patient care, and turn our attention to that. It's a term that I think a lot of our members have been hearing about and reading about for quite a while now. For at least a decade or two, we've been hearing about multidisciplinary care. We've been hearing about integrated care, and I know this is something that both of you are leaders in, are co-leaders actually of this team-based approach in Alberta. And I'd like to hear a little bit more about your definition of multidisciplinary care and how it can benefit arthritis patients?
I'll jump in maybe and
Sure.
talk about, so I think within the broader multidisciplinary clinic that we operate in, we have access to and connect with really readily through the EMR. They're not just down the hall, but our nurse colleagues, physiotherapists, occupational therapists, social workers, all of the team members that are really important to patients who have an inflammatory arthritis or other musculoskeletal disorder. But within our particular practice, we're really an integrated, collaborative, interdisciplinary model where we work together, and with that patient being the center of our team to provide care. So we, as I guess pharmacists in Alberta, are lucky to enjoy the broadest scope of practice in the world. And so myself as a pharmacist working with patients who have a prior diagnosis of an inflammatory arthritis, I'm able to do what pharmacists do, which is making sure that medications are effective and safe for the conditions that they're being used for, and also that patients are able to adhere. So whether that's cost concerns, whether that's the formulation of the particular product or its adverse effect related, and working with patients in that aspect, and making changes, prescribing, ordering lab work, following up with patients to make sure that they're getting the most out of their medications for their arthritis. And we collaborate. So, I mean, in our clinic, I see patients, and, Steven joins the conversation, and, we finalize and settle on a particular plan for that patient on that day. But I'm also lucky I have a little bit more time in clinic with follow-up type of patients, and can talk to them about other medication related concerns, things like their cardiovascular health, knowing that folks are at higher risk for those types of events, as well as vaccines. And we did a lot of work together during the COVID pandemic, and surrounding times, making sure that our patients were really aware of what their risks were, how they could help to decrease those risks, and when and how to get vaccinated. So I don't know what you would add to that, Steven, but I think we've got a neat practice together in the way that we work with patients.
Yeah, I 100% agree. It's excellent care for patients. We know we've looked at it, and patients appreciate this model of care compared to what would be the old physician only model of care. I think they recognize it's better and more integrated for them. And not only does it provide better care, but it also improves overall access, because as Jill said, while she's seeing these patients, I'm also seeing patients as well. So in that clinic time, we've probably increased capacity by about 50%, so if this was something that we were able to make, the standard, 9 to 5, Monday to Friday across the board, the impact would be absolutely huge in terms of wait lists and all that sort of thing that we are all struggling with in Canada right now.
Yeah, it reminds me of another one of these terms that people come across on the internet or when they're reading some story in the media, and that's physician extender. And really, I think what that means in the context of what we're talking about, and Dr. Katz, I'll come back to you, is if we allow, and I think pharmacy is a great example where they have had sort of that formal expanded scope, and governments have recognized it and have enabled it, but we're still working really hard to have that kind of accreditation and acknowledgement for, let's say, physiotherapists. And a lot of our audience and our patients spend a lot of time with physiotherapists. And then you mentioned occupational therapists, chiropractors, dietitians, social workers, all part of that of that multidisciplinary team that patients have. But when it comes to the benefits for patients receiving more comprehensive care, it means they have a different type of relationship with their rheumatologist. Would you agree with that assessment? If we can expand the role of these other practitioners, yeah.
Yeah, I think it can, but again, our data, which we've shown before, is patients, you know, I could see maybe some folks feeling that connection isn't the same. I think we haven't noticed that ourselves of being a concern. Like I said, I think all our patients are very positive about it, are very, you know, I'll sometimes hop in the room at the end for 30 seconds. Do you have any questions? No, because Jill's covered absolutely everything. They're very confident in that care. So I think for some people, maybe there's a change of how what they expect in terms of care, but certainly I'm very confident in terms of the maintaining and really exceeding the quality of care that we would expect just from the rheumatologist in that care, which actually is better in this model.
Right.
Yeah, and I think
go ahead. I was just the specific medical care that they need to get from their specialist, they now have more opportunity.
Yeah, and they're still connected to their rheumatologist. So I was going to say, if patients, you know, go away and have a flare or have a question that comes up, that might come through the EMR, and it might be Steven or I who answer that, right? And so we're still, it's team-based care. They have more access in a way, or a broader, you know, scope of knowledge and skill than a patient who is solely seeing a rheumatologist.
I'd also like to point out to our audience, and we'll provide links at the end of this episode. There are other best practices, not only yours in Alberta, but in other jurisdictions in Canada as well. I'm thinking of British Columbia, where for I think at least 10 years now, there's been a billing code for rheumatology nurses. And that has really, I think, helped transform the practice of rheumatology for specialists in the province. Getting that help and patients getting better served in terms of initial assessments and patient education. So that's been, I think, a really good example. And there are some leaders in British Columbia who we've talked to about that. And also, I'm thinking in Ontario, there's a model of care using what they call non-physician extended role practitioners, ERPs, which is a little easier to remember in arthritis care. And these ERPs receive training from a program called Advanced Clinician Practitioners in Arthritis Care, ACPAC. And that's a training program developed to help prepare physical therapists, as we've mentioned, occupational therapists, chiropractors, nurses in the assessment and management of arthritis. And we just had we've just shared breaking news in Ontario where that model is being applied in Northern Ontario through the work of the Ontario Rheumatology Association. So there are examples out there, and you being one of the leaders, I think, you know, what we're hoping is this spreads across the country in every province and territory. Anything else that you want to share about your practice, your focus? Any final words?
No, I would just agree with what you just said, and I think it's really the only path forward in rheumatology in Canada. We're not training enough rheumatologists over time. That's not going to suddenly fix itself, and if we don't seriously look at and embrace these new models, we're not going to be able to improve access and quality of care for all these really important folks who deserve it.
Mm-hmm.
Well, I think those are great final words, and I want to thank both of you for taking time from both of your busy practices. Thanks again for joining us, and thank you, our audience. This is CR Arthritis, our 10th consecutive year at the annual meeting, and very happily bringing you insights and knowledge from experts at the conference like we've enjoyed today. So thanks again, both of you, and we look forward to seeing you again on another episode. Bye-bye.
Thanks, Kelly.